If you've been stuck trying medication after medication for depression, this is the treatment most people don't hear about early enough. And that delay, that's what keeps people suffering longer than they need to. This is a different option, and it works faster than anything else we've had in depression treatment. Spravato. Here's the part most people miss. This is not just another regular antidepressant. It works on a completely different system in the brain. Most antidepressant medications target serotonin, norepinephrine, and dopamine. Spravato targets glutamate, the system responsible for rebuilding and strengthening connections in your brain. Traditional antidepressants adjust chemistry, Spravato rebuilds circuitry. And that's why the timeline looks completely different. We're not talking weeks. Many patients feel a shift within hours to days. But here's where this changes. This isn't something you take at home. This is what I call the guided reset protocol. You go into a certified medical clinic, you self-administer a nasal spray under supervision, then you sit in a controlled, quiet environment for about 2 hours while your body processes the medication. Lights are dim, you're seated or reclined, and during that time, your experience may feel very different. Some patients describe it like a dream, like they're floating slightly outside their thoughts. That's called dissociation. And let's be clear, this is expected, this is monitored, and it fully wears off before you leave. Feeling different during treatment isn't danger. It's part of how the treatment works. Now you're probably thinking, isn't this just ketamine? Isn't that risky? No, this is a purified, FDA-approved version of one specific component in ketamine. It's the racemic form of ketamine called esketamine, given in precise doses in a controlled medical setting with monitoring the entire time. This is not recreational use. This is structured clinical treatment. That's important, but this is what really matters. Who is this actually for? Spravato is approved for people who have tried at least 2 antidepressants without real relief, and for people dealing with severe depression, including suicidal thoughts. Because in those moments, speed matters. One of the most important things people need to know is this. Spravato is also FDA approved for depressive symptoms in adults with major depression and acute suicidal thoughts or behaviors. Because when someone is in that level of emotional pain, waiting 4 to 6 weeks for a medication to maybe help is not good enough. In psychiatry, timing matters, and in crisis moments, faster intervention can be life-changing. Waiting weeks in a crisis is not a treatment plan. One of the most significant shifts in depression treatment happened in January 2025. The FDA approved Spravato as a standalone therapy for treatment-resistant depression, meaning patients who have failed at least 2 antidepressants can now be treated without needing to combine it with another medication. It's the first and only therapy in its class with that level of approval. Now let's talk about the process. You start with an induction phase, twice a week for 4 weeks, then it tapers to once a week, then every other week as maintenance, as you stay on an oral antidepressant alongside it. This isn't replacing your treatment, it's enhancing it. Now let's clear up one more misconception. Spravato is not a last resort, it's an advanced option. There is a difference. Many patients qualify after just 2 medications that didn't work. This isn't about being out of options. It's about using a different tool sooner. More of the same type doesn't fix resistance, different does. And what about side effects? During the session, you may feel that temporary dissociation. Some people feel lightheaded or mildly nauseous, but those effects are short-lived and monitored the entire time. Once you leave, your system returns to baseline. No daily side effects like traditional medications, no long-term sedation, and in many cases, real relief. But here's the mistake people make. They hear about it, they get curious, and then they wait. They stay in the same cycle, hoping the next medication finally works. Don't do that. If you've been through multiple antidepressants, if you're not where you want to be, if your depression is affecting your ability to function or feel safe, ask directly, do I qualify for Spravato, or is there a treatment center that works with my insurance? Because trying to figure this out alone or waiting for things to magically change, that's the real risk. You don't have to stay stuck. For a lot of people, this is the option that finally moves things forward.